to friends and fam. So just have a couple of things I want to say. Number one, definitely been staying informed, probably over-informed, but also kind of I'm just met with this spiritual inner question of what am I going to do about it, though? I'm really mad. I feel like such a small person in this world. I think the only thing I can do about it is not be quiet about it. And there's something in particular I just wanted to touch on today. The ACIP is currently having their first meeting yesterday and today, since RFK Jr. fired all 17 of the professionals that used to be on this board. And I was listening in to some of the meeting because they are live streaming it on YouTube. You can listen to it and see what they're saying. I have a couple of notes. I'm really proud to be a physician. I'm very proud that I spent 11 years of my life dedicating my brain to study to provide betterment to the American people. I'm a strong believer that medical training really sets us up to do a lot of good for our communities and be the people that have chosen to put in the work necessary to understand how to ask these questions and to understand how to evaluate the research and the evidence. I think that we as a society need to realize that the phrase "there are no stupid questions" does have a limit. I think I would never use the term stupid, but I definitely think people should understand and respect if they do not have the tools to frame a proper question in a certain environment. Strictly because I was watching this committee meeting and there was one person in the meeting who was talking about, I think there needs to be an investigation into other energies that could be at play, increasing the frequency of flus in certain years. And I mean, that's reasonable, but I think at baseline we need to focus on safety, efficacy, and things that we can treat first line rather than dabbling in these other like ethereal energies or whatnot. I thought that was really kind of strange. The other point I'll make is that one of the questions raised by one of the non-scientists on the panel was, the person said, I think we need to have a study that compares the old egg-based flu vaccine with flu block and put them head to head and make sure we know which one is more efficacious. To which the scientific people on the committee presented the study that was done by Kaiser many years ago, showing that they did a head-to-head study exactly like he was talking about. So these things have already been done. I understand we're living in a space where people can't trust things that they cannot see. I would also like to remind everybody that most of these research articles are public record, and if you Google it, you can go to the article on PubMed, you can read the full PDF for free. This information is out there. Whether you feel like reading it or whether you can comprehend what you're reading, definitely I'm here to help answer questions if you have not developed the tools to comprehend it. Everybody starts from a different place. Everybody has a different capacity for how much they can research in terms of time, how much they can research in terms of what they understand from a background knowledge. As you go further in training and in schools, you often find that different specialties and different areas of study will sometimes feel like walking into somebody in a foreign country, doesn't speak your language, you don't understand anything, because the language that we use in different industries takes time to learn and understand. The statistical models that we use to evaluate data takes time to learn and understand. Statistics is the only B I ever got in college. Hated that class. Definitely my brain gets a little lost with that deep math. I can follow you up through calculus, but when we start talking about rigorous statistical models, my understanding as a non-mathematician does kind of start to have some issues. However, we're taught all through medical school about how to recognize bias in studies, and bias is something I want to talk about because whenever you have a pre-study bias, meaning I have feelings about something, I think this is the outcome, I think children are getting too many vaccines, or I think vaccines were approved because there's this money grab and I don't think the data was tested rigorously, or I think vaccines cause autism, even though we have many studies proving that they don't. Then, when you're designing a study and a scientific question, sometimes you come in with that bias, even if it's subconscious, and that bias is inherent in your question, and it will lead you down a path and you will get the answer that you want. We call this confirmation bias. So that's a big dicey subject, but it's very intricate and nuanced, and if you don't want to acknowledge that, you're just gonna have to, I don't know, figure out how you can acknowledge that, because you try to go evaluate all the research articles, come back and tell me what you learned, and we'll decide. If you only looked up articles confirming what you wanted to confirm, there's your bias. If you don't look at the whole body of the evidence, you're missing pieces. So that's number one. Number two is I want everybody to pay very, very close attention if they change the pediatric vaccination schedule. Here's the problem. I believe confidently in the pediatric vaccination schedule. I believe we have a large body of evidence guiding these decisions, and we've put to rest the risk of harms, which is number one in healthcare. We have to take a vow, and they do a big ceremony, and they do a big introduction, education, production of the whole Hippocratic process very early on in medical school, like month 1 or 2. We have to understand it. We have to stand in our white coats, raise our right hand, take this oath. And that oath is to first do no harm, that we're going to overturn every stone and we are not going to intentionally do harm. Now, if they change the pediatric vaccination schedule, what's going to happen is the insurance companies will quit paying for the vaccines they say that are not necessary. We are then at that point going to create a larger gap in healthcare disparity based on wealth in this country. When I purchase vaccines for my practice, they cost me anywhere from $30 for your standard flu vaccine up to about $450, $500 to buy some of the newer RSV or shingles vaccines. COVID falls somewhere in the middle, like $250, $300. That's the cash pay price to buy these vaccines and then have them available to dispense to the public. If the healthcare industry was not trying to make a dime off of anything, if they were strictly nonprofit, the patients themselves would still be paying $250 to $400 per vaccine just from the pharmaceutical cost. Now, what's going to happen is you're going to have families that have higher levels of means that say, I still believe in science. I'm still going to do what my doctor tells me. I don't want to spend $1,000 at my pediatrician's office on vaccines, but I'm going to fucking figure it out and my child will be vaccinated. There are so many people in this country that do not have that privilege. So these children are going to go unvaccinated at higher rates, not by choice, but by financial pressure. Then we're going to have children getting sick from vaccine preventable illnesses, and we're going to see things like we saw the year before the RSV vaccine became approved in the United States. For the record, they were using it in Europe for several years before we got on board. The year before we started vaccinating for RSV in this country, the pediatric ICUs were at max capacity in multiple areas of this country. Children were had to put on ambulances and transported 2 and 3 hours away, in some cases, from the ER that they arrived at, because that hospital did not have the capacity to have a bed for them. Children will die. Children that are trying to come to the emergency room or their doctor's office for something that's not the vaccine preventable illness will be harmed and will have further delays in care because the healthcare system, which is already overburdened, will become even more overburdened with resources being funneled to stuff that a simple vaccination that is incredibly safe and rigorously evaluated could have prevented. because you have inherent bias, does not give you any right to start this domino effect in which children will die. Don't even get me started on the fact that we're rapidly removing rights from women to make the active decision as to whether or not they want to bring a child into this world. So we're going to force you to have a baby, and then we're not going to let you vaccinate it. And even if you wanted to have a baby and you're happy to do that, maybe you can't afford the vaccinations if you choose to do it. Let's say you wanted to have a baby, you afforded the vaccinations, you came out of pocket hundreds of dollars to make sure that your child was protected. But let's say your child gets some other illness, some other cold or something that wasn't something they were vaccinated for, and they start developing febrile seizures. And you take your child to the local emergency room, but they turn you away because they have no beds, because their beds are currently full up of kids fighting the flu, the pneumonia, the RSV, whooping cough, all because they couldn't afford a vaccine, because the insurance companies only pay for what we force them to pay for. And they didn't get this coverage because somebody who wants you to deny levels of evidence that has been rigorously tested has come up with a way to force bias into this guideline directing body in order to get the decisions made that they want to be made coming from their bias. Pay attention. I'm not going to be quiet. That's all I can do.